Should I tell my age? Okay, I'm 52. Probably about 3 or 4 years ago. And, you know, I was aging, I'd been through a lot, and I was not happy with, you know, the sagging and wrinkles, and I think I was applying more and more makeup, and I'm looking old, and I don't feel old. I'm very energetic. I have a long way to go with my journey in my life, and I just felt like if Dr. Brauman could fix my tattered sails and I could take this one ship that I'm given, there are no trade-ins, we have to sail the same ship from beginning of life to the end, that I should take advantage of it. Why wouldn't I?
Debbie pretty much had all the hallmarks of aging. It was the eyes, it was the brows, the upper and lower eyelids, the brows. She had the issues of sagging and volume changes. All of these issues come together. It's really important when you do this work to, when you're done, essentially, to have the person look natural, meaning looking herself and not looking like somebody else, or not having those, what I call the side effects of facelifts where you look too pulled.
Were you ever concerned when you decided to do something to your face that the results might be unnatural and you might have that surprised look that some women get?
Yeah, of course I was concerned. I mean, I think it's one thing to have things done to other parts of your body, but when it comes to your face, you can't hide that. And you can apply makeup or try to balance things, and I was very nervous.
Most people, when they come in, say to you, and that is very common when people come in to have work done on their I don't want to look pulled, and I want to look like myself. I do not want to look like somebody else. And the reason for that is because, you see, a lot of celebrities not looking that good after having facial plastic surgery. And the reason why is because various procedures are distorting, I believe, their features. You see, there are two major ways in which plastic surgeons tighten a neck. They either move the muscles inwards or they move the muscles outwards and tighten together with the face. And instinctively, I always moved the muscle inward, in that direction, opposite to the direction that you would actually pull the skin. I came to realize that the connection of a pulled mouth was because when you are tightening the muscles out, you are pulling on the corners of the mouth. And that is what pulls the mouth out. And if you tighten the muscles in, what you are doing, you are essentially stabilizing the corner of the mouth, and you're not allowing it to be pulled. And the reason is simple. It's not simple anatomy. The muscles of the neck are inserted into the corners of the mouth, and that is what the solution is.
Is this a major breakthrough?
Well, it was for me, because I was able to say to every patient that walked in, and I've not seen it written anywhere actually in plastic surgery literature to this date, obviously. And I've always been able to say to my patients, I'm not going to give you a pulled look.
Right away, my teenage daughter, who's 18, said to me, this was just a few days after, and I was still swollen, and she said, Mom, you look better than I've ever seen you look. And then she said, you look better than the photos that I've seen of you back when you were even Miss New York. And I'm like, wow. I think, oh gosh, and I've got a long way, you know, a little bit more healing to do, and so I was very, very happy with that. I never did have a strong, you know, neck, so I mean, he gave me that God didn't give me, so. And actually, bags under my eyes, the dark circles, I don't have that anymore. I don't even put the cover up on underneath.
You did extensive work on Debbie's eyes, yet they look very natural.
Thank you. When I look at the eyes, you always have to look and see what the problems are. Are the problems with the lower lids, the upper lids or the area of the brow, and you have to address those things separately. You know, I've been very disappointed with brow lifts in general because unless you do a very extensive brow lift and you make incisions in the hairlines and so on and so forth, you cannot really get, in my opinion, decent results with a brow lift, meaning that you are raising the brow. And even when you do that, many times people end up with surprised looks because of the brow that's raised too much. So what I do nowadays, which is very straightforward, is that just about every time I do an upper eyelid surgery, the brow is right there. So I go a little bit higher up and I fix the brow in its correct position. This is a great procedure. It gives you a very conservative effect on the brow, and it doesn't let you have a brow that's too high and a surprise look. It just brings it in the right position.
I feel freer than I probably ever felt, because even back when I was 20, 25 years old in the pageants, they, you know, that was a heavier makeup and everything time anyway. So now I don't have to do it. I actually feel like I look younger, feel, you know, I'm much more confident.
It's a nice look, and that is the most important thing. She doesn't look tired. She doesn't look, you know, old. She does not have all the effects of aging which make you not look good.
I wasn't even expecting this much, and I think I really wasn't even sure exactly what Dr. Brauman was doing until it was done, because I just sort of I said, you know, you're a fixer. What would you do? And he's the expert, he's the artist, he's the surgeon. So I trusted him, and he said, I know what I'm doing, and he obviously knew what he was doing. So I'm very happy with the results. It's more than I even thought it would be. It's better.